Hello, I am Dr. Suraj Manjunath, Chief of Surgical Oncology at VIkram Hospital, Bangalore. Cancer continues to remain a dreaded disease. With the control of communicable diseases and people living longer and longer, we see a rising incidence of non-communicable diseases like cardiac, respiratory and cancer issues. Common cancers that we see in practice in India are breast, ovarian and cervical cancer in women, and gastrointestinal and oral and prostate cancer in men. The mainstay of treatment for cure in cancer is surgery, radiotherapy and chemotherapy, along with associated therapies like psychotherapy, palliative therapy, pain medicine and others. Surgery is no longer as difficult or painful or disfiguring as it used to be in decades past. Today we have moved to the era of minimal invasive surgery, enhanced recovery protocols and organ conservation surgery other than others. People live a normal and completely normal life, pain-free life, and just like they were before after treatment for cancer. It is important that patients adhere to their treatment protocols, complete all the treatment in a multidisciplinary team comprising of a surgeon, a surgical oncologist, medical and radiation oncologist if necessary. Cancer today is most of the time completely curable provided it is detected early enough and provided the treatment is completely taken by the patient. Every patient of cancer is different. So the treatment that a particular patient will receive depends on his own self, that means age, other diseases which are present like hypertension and diabetes, the type of cancer, the stage of cancer and the treatment plan. So every patient receives a tailored recommendation for treatment. This treatment may be a single treatment like surgery or radiation or chemotherapy, but very often it's a combination of these above three. Any two or all the three of these may be required depending on the above factors. In breast cancer, for example, today up to 98% of patients in stage 1 are completely cured. Most patients of stage 1 do not require removal of their breast. It is organ conservation, painless. One day we send patients home now after surgery for breast cancer on the same day evening. So things have improved a lot and they continue to improve. Both the survival, the chances of cure as well as the difficulty or the suffering involved in taking the treatment are becoming lesser and lesser as days go by. We have many newer technologies in surgery for cancer like minimal invasive procedures, laparoscopy, thoracoscopy, robotic surgery, use of lasers, use of enhanced recovery protocols, use of artificial intelligence software for detection and treatment of breast cancer especially. We also have advances in other fields of cancer medicine like radiation, improved radiation techniques, newer molecules of chemotherapy and targeted therapies as well. We also now integrate multidisciplinary avenues for every patient, including their psychosocial therapies, palliative medicine, integrative oncology, yoga and other things as well. In cancer surgery, patients now are very often admitted on the morning of the surgery itself, and many can be discharged on the same day or within a day or two. Recoveries are faster, pain relief is better, and patients are rehabilitated almost completely and very quickly. The most important cause for cancer in India continues to be use of tobacco, either as smoking or chewing. And the single most important thing anybody can do to prevent cancer is not to use tobacco at all, or if one is using, to stop using it. The next most important thing I feel is people should not ignore early signs of cancer. Any slightest suspicion, meet your doctor and rule out the presence of a cancer. The most important thing that a person who has got cancer can do is to go to the doctor at the earliest stage and take the appropriate treatment recommended for him. Many people ask us tips about how to prevent cancer in the first place. The single most important thing is not to use tobacco in any form, or if you are using, to stop. Other than that, maintain a healthy weight, be physically active, eat a variety of foods, especially fresh food, fruits and vegetables, drink plenty of water. There are many myths that continue to be associated with cancer. Cancer definitely is not contagious. It does not spread from person to person. People at home, friends and relatives have absolutely no chance of contacting cancer from their loved ones. Most cancers are not hereditary. Just because some person has got, most of the time does not mean that others in the family will get it as well. Cancer patients can and do live a normal or near normal life after treatment. Another myth is that the diagnosis of cancer is a death sentence. My life is over. It is not so. It is a shocking news whenever we tell it to anybody, but majority of the patients now, especially those in early stages, are completely curable provided they take the right treatment. Right knowledge is right health. Stay tuned to this page for more such educational videos.